Good morning, Professor and classmates. Today, my group and I are going to present the following topics: medical tests, wound care, medications, vital signs, hygiene, and patients. I hope you enjoy it.
I am going to tell me about medical testing and using the Gemini AI. Medical testing procedures are essential components of health care. Their primary goal is to detect, diagnose, or monitor disease and health conditions, enable professionals to determine the most appropriate course of treatment. Reading for simple, bold, and unary analysis to sophisticated images like MRI scan. The test provided the objective information necessary for informed clinical decision making and ensuring patient safety. Common types: laboratory tests, medical imaging, in vivo diagnostic, and genetic testing. High consideration: kit sensitivity and specificity, and decision making. Preparation: fasting, avoiding substances, and hydration. Thank you.
Hello everybody, today I'm going to talk about wound care. Wound care is very important in health and nursing because our skins protect us from germs and infections. When the skin is hurt, we need to take good care of the wound so it can heal well and fast. A wound can happen for many reasons like incidents, burns, surgery, or disease like diabetes. Every wound is different and it can need a special treatment. The main goal of wound care are to keep the wound clean, protect it from infections, and help new skin grow. Nurse and doctors clean the wound, cover it with dressings, and sometimes use medicine or cream to help it heal. The healing process has 4 steps. First, the blood stops the bleeding. Second, the body fights infections and cleans the area. Third, new tissues start to grow. And last, the wound becomes stronger and close. This can take a few days or sometimes many weeks, depending on the person and the size of the wound. Some things can make wounds heal slower. For example, poor diet, smoking, diabetes, and not cleaning the wound well. That's why good nutrition is so important. Foods with protein, vitamin C, and zinc help the body repair skin and tissue faster. Drinking water and eating fruits, vegetables, and healthy foods also help a lot. Nurses also work to prevent new wounds like pressure ulcers, which appear when patients stay too long in the bed. They move the patient, keep the skin dry and clean, and check the body every day. Today, we have many treatments to help wounds heal, like special dressings and machines that help remove fluids. But the most important thing is always prevention, taking care of our skin and keeping it healthy. In conclusion, wound care is about more than cleaning a wound. It's about helping people feel safe, healthy, and comfortable. Good wound care and good nutrition work together.
Medication in nursing. Medication in nursing in the process through with nursing. Prepare, administer, and monitor medication prescribed and doctor, ensuring their safe and effective use. This process includes verifying the fight right patient, right medication, right dose, right route, and right time. Observing for adverse reaction, educating the patient about their treatment, and recording of medication administration.
Hi, my name is Jamilka Jimenez. Now I'm going to talk about the vital signs. The vital signs reflect essential bodily functions, including heart rate, respiratory rate, temperature, and blood pressures. Normal vital signs vary with age, sex, weight, exercise capacity, and overall health. Body temperature. It measures the body internal heat, the balance between heat production and heat loss, approximately 36.5 degrees Celsius to 37.3 degrees Celsius. Heart rate, the number of beats per minute reflecting cardiovascular functions, 60 to 100 beats per minute are in adults. Respiratory rate is the number of breaths per minute and reflecting lung functions from 12 to 80 beats per minute for adult rest, some sort say of 20. Blood pressures. It is the force exerted by the blood against the arterial walls, less than 120 by 80 millimeters of mercury over the systolic over diastolic. Oxygen saturations, percentage of oxygen in arterial blood. Normal range is the 95% to 100%. This play an important role in emergency service and hospital wards in identifying patients at risk of deteriorations. Degree of vital sign anomaly canals predict long-term patients' health outcomes. Recurring emergency room visits, hospital readmissions rates, and healthcare resource utilizations. Vital signs are appropriate for characterizations of quantifying cardiovascular and pulmonary signs and symptoms as part of an assessment of aerobic capacity and endurance. Stable vital signs reflects a healthy lifestyle and proper disease management. It's not just about normalizing the in the moment, but about maintaining habit and care that prevent long-term disturbances.
Hygiene is the set of habits and measures aimed at preserving health and preventing diseases through the cleanliness of the body, food, and environment. It's not just about being clean. It involves regular routines, informed decisions, and the control of biological, chemical, and environmental risks. Why is it important? Prevention of infections. It reduces the transmission of viruses, bacteria, and parasites, whether it's diarrhea, flu, fungal infections, or skin and respiratory infections. Physical and mental well-being. It decreases irritation, bad odor, and discomfort. It improves self-esteem and personal image, social and economic impact. Less absenteeism from school and work and less unnecessary use of antibiotics. Basic principles, regularity, proper technique, a comprehensive approach, and prevention and safety. Main areas and recommendations. Hand hygiene. Wash with water and soap for 20 seconds, including the palms, back of the hands, between the fingers, nails, and thumbs. Use alcohol gel at 60 or 70% if there is no visible water or if hands are dirty. Critical moments before eating, cooking, after using the bathroom or arriving home, after coughing or touching trash or animals, and when in a patient's environment. Body hygiene. Bathe or shower according to the weather. General activity should be daily or every other day. Careful drying of skin folds and changing underwear and socks every day. Keep nails short and clean. Oral hygiene. Brush 2 to 3 times a day with fluoride toothpaste for 2 minutes. Use dental floss once a day and have regular dental checkups. For proper hair hygiene, wash your hair as often as needed, on average 2 to 4 times a week. Additionally, avoid sharing personal combs or hats with others.
My name is Carol Montezuma, summary and patient in person to go rising a medical care treatment for a healthcare professional and doctor nursing on therapy patient my CU cartoon basic physical and mental health condition for preventive and services like vaccination. Patient individual go to do medical attention for condition today and trata in hospital clinics depending on the situation to relation or between and patient and healthcare communication and confidentiality con diagnosis and treatment improving the patient health care and quality of life. Good patient care is essential because if through improving communication and how to go patient to treat and read today feel more comfortable and more like to follow medical treatment plan respectful treatment reduce patient and creative positive and experiences. Healthcare professional understand the patient to next evaluation and consent into overall quality of care. And summary and trata and patient with to knows about to
Hi there, my name's Leah. I'm one of the junior doctors working on the ward today. Is it okay if I just check your full name and date of birth, please?
Yeah, Harry Miles, 21st of the 10th, 1998.
Thanks very much, Harry. So today I've just been asked to check your observations, so that will just involve me checking your blood pressure with a blood pressure cuff, having a feel of your pulse and checking your heart rate, and I'm also going to check your oxygen levels and your temperature as well. Is that okay?
Mm-hmm.
Thank you very much. Okay, Harry, so could I start by feeling your wrist, please? Okay, I'm just going to pop this on your finger. I'm just going to pop this on your arm, Harry. And if you just relax that down for me. That's great, thank you. I'm just going to pop this in your ear, okay? That's great, thanks.
Once you've completed recording the patient's vital signs, it's important to document them on the appropriate chart. First, document the date and the time that you recorded the patient's vital signs. You can then document the patient's respiratory rate and then their SpO2 level on the appropriate scale. Note if the patient was receiving supplemental oxygen and provide further details including flow rate and device type. Document the systolic and diastolic blood pressure and draw a line between them. Then record the patient's pulse rate. Document the patient's consciousness level using the ACVPU scale. Note the patient's temperature. You can then calculate the news score, which can then be used to inform monitoring frequency and the need for escalation. Finally, add your initials.